New research shows the number of children exposed to second-hand smoke in cars isn't decreasing, as the government claims. In fact, it may be on the rise. A letter published in the New Zealand Medical Journal today says it's time for the government to act, with around 1 in 5, or at least 90,000 children, riding in a car with a smoker each week. The Health Select Committee has even recommended a ban, and surveys have shown public support as high as 97%. But the government has repeatedly refused to entertain the idea. Richard Edwards, the lead author of the letter and co-head of Otago University's Public Health Department, told Zach Fleming it doesn't make sense.
These children need protecting, and what we've shown with our study is that a very large proportion of children in New Zealand are not protected, and if anything, that number is increasing.
Yeah, and in this letter you haven't just presented the data and said, here it is. You've actually said to the government, look, these are your reasonings and these are your excuses as to why you haven't implemented any legislation, and here is why you're wrong. So can you please go back and take another look at it, right? Are you still hopeful that you can convince them to change their minds?
Oh, very hopeful, yeah. I mean, so the government the Health Select Committee recommended that a law be brought in to ban smoking in cars with children in them. And the government responded in March, and what they said was that current initiatives are sufficient to deter smoking around children. They acknowledged the serious health risks, but they said essentially enough's being done. And they didn't provide any evidence that that was deterring smoking around children. So we provided that evidence, and I think now, hopefully we've provided the evidence, the government will have another think, say, oh, okay, there's actually a lot of children exposed, and it's not decreasing as we had hoped. So, so we're hoping the government will change their mind. A lot of governments around the world have already introduced this sort of legislation, both at national level, such as the UK, or at state and province level in Canada, Australia, and the US. There's a whole lot of states and provinces.
Yeah, as recently as the end of last year, Scotland introduced it.
Yeah.
$100 on-the-spot fine if you're caught smoking in a car with your children in it.
Yeah.
I asked Nikki Wagner, the minister in charge, for a response to this today, and she emailed me back and didn't this time choose to say that current initiatives are enough. She simply said that the government is focusing on stopping people smoking, full stop, end game, as opposed to doing anything with this. Do you believe that they can do both at the same time?
What I've seen said in government responses recently is that doing that is enough to protect children. And I would say, well, these children actually are being exposed now. You know, they've got a risk of bronchiolitis or meningitis or blue ear or whatever now. Those efforts to reduce smoking and achieve the Smoke-Free 2025 goal are going to take a few years, even if we're lucky. So what we're saying is that children need protection now. We'd completely accept the government, if it says that it wants to really focus on reducing smoking down to minimal levels, which is the goal. That's great, but we also think that at the same time, let's protect children along the way and make sure they're not exposed to a very hazardous and toxic exposure that increases their risk of very serious diseases.
It's Richard Edwards, who's the co-head of Otago University's Public Health Department, talking to our reporter Zach Fleming earlier today.